and good afternoon again. I am thrilled and honored to be here. I'm really grateful to Madame Liina Kersna for letting us to happen this exceptional event. Welcome, dear delegates from European Speech and Language Therapy Association, and welcome, dear colleagues from Estonian Logopedists Union, and of course, welcome all the presenters. As I told you, I'm really grateful that you accepted our invitation and to have this seminar with us. This is kind of tradition already, as we have had several seminars in European Parliament, in Parliament of France, and now in Estonia. Some organizational things. I want to admit that that's not the first time Estonia has General Assembly of ESLA. It is the second time. First time, it was 22 years ago when President of Estonian Logopedists Union, Veronika Raudsalu, hosted the General Assembly with the help of delegates of Merit Hallap and Birgit Kaasik. So it was also an event to remember. But now about some organizational things. First of all, the seminar will be recorded. And you have to keep that in mind. It will be shared amongst the ESLA's members. The second topic is that we have a coffee break here from 2 to 2:20, and I must ask you to follow that time because we must leave the building at 4. And I guess that's the most important thing. After the presentation of Sahra, Mengal will be a short discussion, open discussion, so you can think about questions to ask. But now I would love to start with the welcoming addresses, and first of the speakers is Keiu Barndõk, who is now President of Estonian Logopedidide Assotsiatsiooni.
Dear guests, colleagues from Estonia and across Europe, welcome to Estonia, welcome to the seminar. Seeing us all here together is inspiring. It shows that our profession goes beyond borders, cultures, and languages. It is essential in every corner of the world, or at least in Europe. But where do we stand here in Estonia? I am proud to say that Estonia has a strong foundation. Our SLTs are trained at the University of Tartu, an institution with a long academic tradition and internationally recognized quality. Estonia educates highly qualified and broadly skilled specialists. Yes, we need more of us, but with well-organized service models and smart allocation of resources, the existing workforce can already be used effectively. And per capita, we stand very well even compared to our Nordic neighbors in Finland. What we need now is time and continuity, the space for the system to stabilize and to make the most of this excellent workforce. Estonia has one unified profession, not separate tracks for healthcare and education. Every graduate is fully qualified to work across settings, and most of us believe this unity is our strength. It ensures consistency, mobility, and a shared professional identity in our small country. Until now, SLTs in Estonia have been trained alongside with special education teachers. One of the most important steps ahead is an independent master's curriculum in speech and language therapy. The Estonian Logopedists Union strongly supports its opening in the year 2027. Why is this important? Because the new curriculum significantly increases the volume of profession-specific subjects, ensuring deeper expertise and better readiness for real-world practice. We also welcome the plan to increase the number of students admitted, as Estonia continues to need qualified specialists. And classifying the curriculum under the healthcare field is a strategic step, one that supports the long-term sustainability and international competitiveness of our field. Our clear understanding is that every child has the right to develop in their natural environment, surrounded by a supportive team. Early childhood education plays a central role here. When the foundations are laid in kindergarten, the positive impact in school is remarkable. Estonia is committed to providing support in the child's everyday environment, where learning and communication naturally take place. Also, multilingualism is an increasingly important topic for us, as every child needs support regardless of their home language. At the same time, we are focused on the transition to education in Estonian. Multilingual children need the right kind of support in these circumstances, and here we value the experience of our European colleagues. Of course, like every country, we also have areas that require attention and further development. How can we reach families in rural regions and ensure continuity of support? How can we guarantee reasonable and necessary environmental conditions for SLTs to work effectively? How can we ensure fair salaries and manageable workloads for SLTs in every part of Estonia? We certainly cannot be just satisfied with the current situation. But the overall direction is positive. Estonia recognizes the importance of our field and is committed to strengthening it further. Perhaps the most telling indicator of quality is the feedback from families. When parents are asked what they would improve, the most common answer is about the content of the therapy. It's not about the content of the therapy, it's simply, we wish there were more of it. Those who receive the service are satisfied and grateful. This is something we can be all proud of. Speech and language support is not a luxury, it's an investment that pays off across a lifetime. We are proud of Estonian SLTs, proud of their knowledge, their dedication, and their commitment to clients and families. And with the steps we are taking, Estonia is moving in a strong and promising direction. I wish you all an inspiring afternoon and sincerely thank you for taking time to visit Estonia.
Our next welcome address is President of European Speech and Language Therapy Association, Sahra Mengal. Welcome.
Can you hear me? Yes. Well, dear colleagues and distinguished guests, it is a great honor for me to be here today at the Estonian Parliament for this important seminar on speech and language therapy in Europe. On behalf of ESLA, I would like to say thank you to the Estonian Logopedists Union for their initiative, collaboration, and commitment in organizing this event. But I also want to thank you, Madam Liina Kersna, and Marja-Liisa. Is that correct as well? Well, thank you so much for also contributing to this very important event. ESLA is especially grateful for the opportunity to meet here in such a beautiful setting where professional knowledge, research, and policy can come together. I would also like to thank the Estonian Parliament for hosting us today and for recognizing the importance of speech and language therapy as part of a wider discussion on health, education, inclusion, and equal access to services. Speech and language therapists play a vital role in supporting people across the lifespan. Our work, reaches children, adults, families, and communities. We support communication, swallowing, participation, and quality of life. So in many ways, our profession is closely connected to some of the most fundamental aspects of being human, and that is the ability to communicate, to be understood, and to take part in society. This is why meetings such as today's are so valuable. They bring together professionals, academics, and policy perspectives on speech and language therapy. It also allows us to exchange knowledge, learn from each other, and reflect on shared developments and priorities across Europe. As speech and language therapists, we work in a field that is deeply connected to communication, participation, and inclusion. So these themes are relevant not only in clinical practice, but also in research, education, and policy. So I'm especially proud that today's program includes contributions in research, current research, and wider European developments in our profession. I really hope this seminar will create space for constructive dialogues, new connections, and continued collaboration. So once again, my thanks to all of the important organizers. I would also like to thank the ESLA board for their continued support and commitment to strengthening collaboration across Europe. In particular, I would like to thank and acknowledge our board member, Helge Müller, for all of her efforts and valuable contribution to making today's seminar possible. I really look forward to all of the presentations and our discussions. So once again, many thanks to everyone who has contributed to the event and also to all of our participants, because without you, we wouldn't be able to have this seminar. So thank you very much.
And now I have a great honor to ask to speak a stand Liina Kersna, member of the Estonian Parliament and chairwoman of the Cultural Affairs Commission. You're welcome.
Thank you very much. Dear speech and language therapists from Estonia and across Europe, welcome to Estonian Parliament, Riigikogu. Yes, my name is Liina Kersna, and I am the chair of Cultural Affairs Committee in Estonian Parliament, where alongside cultural affairs, we work with educational issues as well. I am also a doctoral student in education and science, and I hope to finish my study this year. Before this role, during the COVID time, I served as a Minister of Education and Research. And through my work and studies, I have learned that speaking is deeply connected to learning. Speaking means learning. When children are encouraged to think about their learning, and if they express in the words what they have learned, then the real learning has begun and development happened. That is why the ability to speak is such an important foundation for learning. But today we see a worrying trend. Technology has reduced face-to-face communication between people, not only between adults, but also between parents and children. But children develop speech, language, and empathy through real human interaction. When adults talk with them, listen to them, and look them into the eyes. Thanks to your meaningful and research-based work, many people who would otherwise struggle to express themselves are able to find their voice. You help people communicate, learn, and fully participate in society. And it is very, very important. Thank you very much for the important work that you do. I wish you an inspiring and productive seminar here in our Parliament building. You are very, very welcome. Thank you.
Thank you. Liina. Can you wait for a second?
We have a small token of appreciation for you. So thank you very much for contributing.
Oh, thank you. Thank you very much.
Thank you, Madame Liina Kersna. Unfortunately, she has to leave, but we are really grateful, and I hope to collaborate again. Now we have reached to our first presentation, and the first presentator is Sahra Mengal, the president of ESLA. And the topic of hers is really important for us all. The future of speech and language therapy in Europe, innovation, access and equity. You are welcome.
Thank you, Helja, and hello again. So, as I said before, it's a great pleasure for me to be here with you today and to speak about the future of speech and language therapy in Europe. The title of my presentation is The Future of Speech and Language Therapy in Europe, Innovation, Access, and Equity. These three words are closely connected. Innovation is actually changing how we work and how services are organized. Access remains one of the major challenges across Europe, and equity reminds us that availability of services is not enough. People need the right support at the right time in a way that is meaningful for their lives, communication, and circumstances. As chair of ESLA, I want to speak about the future not as something distant, but as something we are already shaping through our decisions about education, standards, services, and professional responsibility. So my main message today is that the future of speech and language therapy in Europe must be innovative, accessible, and equitable, but it must also be grounded in professional competence and public trust. So I would like to begin by framing the talk around three connected themes. The first is innovation, and this includes a variety of elements like digital tools, artificial intelligence, data, new service models, and new ways of collaborating across sectors. The second is access. This is about whether people can actually receive support when and where they need it. It also includes referral routes, waiting times, continuity, and how services are organized. The third element is equity. Equity asks whether support is fair, is inclusive, and if it's appropriate for different people and communities. So equity actually draws attention to language, disability, geography, digital exclusion, and social inequalities. It's important that these themes are not treated separately. Innovation only matters if it improves care and contributes to better access to services. Access is only meaningful if it is fair and relevant to people's lives. And equity actually requires us to look beyond averages and consider who is still underserved or excluded from our services. So the question is not simply what is new. The question is what kind of future are we building and for whom? The context for speech and language therapy is changing across Europe. Demand is growing, and the needs we are asked to respond to are becoming more complex. Demographic change is one part of this. Across Europe, we have aging populations and more people living with long-term health conditions and communication or swallowing needs. At the same time, children and young people need timely support for speech and language and communication and feeding. So these needs are closely connected to learning, as you just heard, literacy, social participation, and inclusion. Europe is also linguistically and culturally diverse. Multilingual practice is not a specialist issue on the margins of our work. It is central to assessment, intervention, and family-centered care. And digital transformation is already influencing our services, even our education program and our research and policy discussion. So again, the future is not something that will arrive later. Many of these changes are already here. So again, we have another important question, and that is how we respond. And ESLA's point of view is that we should respond with evidence, collaboration, and clear professional standards. When we speak about innovation, it is easy to focus only on technology, but innovation is broader than technology. It includes new tools, but also new ways of organizing services, collaborating with others, involving families and communities, and using evidence. For speech and language therapy, the value of innovation should be judged by its contribution to care. So, innovation should help people communicate, participate, and make decisions in their daily lives. And it should strengthen our clinical reasoning and professional judgment. It should also improve access and reduce inequalities and support sustainable services. And at the same time, protect the safety, dignity of our patients. So this means that innovation should be purposeful. I believe, and I think all of you in this room believe, that new tools and new models should not be adopted simply because they are available or impressive, or we just saw them on Instagram. They should be adopted because they add value for service users and professionals and systems as well. So this is a really important distinction. Our profession should be open to innovation, but it should also be thoughtful and critical about how innovation is introduced. As you all know, artificial intelligence and digital tools are already influencing our field. There is great potential here because digital and AI-supported tools may be a huge help in our services. They can help us with documentation, early identification, therapy planning, and so on. But there are also important risks. Speech and language and communication data are highly sensitive and variable. AI systems are shaped by the data used to develop them. So if those data do not represent different languages, even dialects, ages, and communication profiles, the outputs might be unreliable or biased. So this is particularly important in speech and language therapy because communication, as you all know, is deeply personal and strongly connected to identity, culture, and context. And for that reason, responsible AI needs SLT leadership. Speech and language therapists should be involved in the development, evaluation, and implementation of tools that affect our work and the people we serve. Technology can support practice, but it cannot replace professional judgment. So we still need evidence and we still need transparency, human oversight, and strong data protection when dealing with AI and digital tools. I want to talk more about technology because digital transformation does change professional responsibility, but it doesn't make clinical judgment less important. In many ways, it makes it more important. Future speech and language therapists will need to evaluate outputs from digital and AI-supported tools. They will need to understand limitations and bias. They will also need to recognize when a tool is wrong or not appropriate for a particular person, language, or context. They will also need to understand data protection and clinical accountability. So this has real implications for education and continuing professional development. I think we should operate with a term called AI literacy because AI literacy should sit alongside research literacy, ethical judgment, and clinical reasoning. So strong initial education and continued professional development become more important, not less. Without professional judgment, technology can create false confidence. With professional judgment, I believe technology can become a useful support to better care. I've had one-to-one meetings with a lot of our associations, and when I talk to the different delegates and their presidents, there is one thing that is truly, that becomes so visible to me, and that is access is one of the most pressing issues for speech and language therapy across Europe. But access is not only about whether a service exists, it is shaped by the whole pathway. How people enter the system, how long they wait, whether support is available in the right setting, and whether there is continuity between services. For many people, direct specialist intervention will be essential. For others, access may also be improved through consultation, preventive matters, group approaches, or community-based work. It could also be collaboration with families and other professionals. So improving access is simply not about providing more appointments. It is about organizing SLT expertise in ways that respond to people's needs and contexts. The aim is timely, appropriate, and meaningful support, and that is something that I really believe that each and every European SLT really yearns for their patients and for the families they are supporting. So better access means the right support at the right time in the right setting. But to improve access, we also need sustainable models of care. Our aim is not simply to dilute specialist expertise. The aim is to use specialist expertise effectively. In some situations, individual specialist intervention is essential. In others, access may be improved through a combination of universal, targeted, and specialist approaches. And this may include parent coaching, teacher collaboration, or community-based support, or telepractice. But these approaches need to be appropriate and evidence-informed. We also need to strengthen our pathways for people with communication and swallowing needs across the lifespan, including those who require specialist or ongoing speech and language therapy support. Workforce planning is central here. It must not only address numbers, but also we need to invest in supervision, placement, retention, and working condition and professional environments for the speech and language therapists. Our strong workforce is not only about training more people, it is also about enabling professionals to develop and stay and lead the profession. A European discussion about the future in speech and language therapy must also include education and professional standards. Across Europe, we have different education systems, different regulatory arrangements, and different service contexts. That diversity will remain, and it should be respected. But at the same time, there is value in developing a clear, shared understanding of the knowledge, skills, and competences expected in speech and language therapy services and practices. And this is where the common training framework is relevant. The common training framework work is still ongoing in ESLA. And it is a careful European work towards a possible shared reference point. The common training framework can actually help structure discussions about education, competence, and professional responsibility. It can also support ESLA's member associations when they are speaking with their ministries, universities, or regulators regarding the professional standards in their country. For us in ESLA, and it's the board, but also our delegates, the important point is that the CTF work keeps workforce discussions connected to quality, competence, and public trust. This slide summarizes the common training framework discussion in 3 ideas. The first one is shared understanding. The CTF work can help develop a clear European language for the knowledge, skills, and competences expected in speech and language therapy practice. The second framework or idea is respect for diversity. European countries have different education systems, regulatory arrangements, and professional contexts. A European framework must recognize this diversity rather than to try to erase it. And the third is quality and trust. Discussions about education, workforce, and mobility need to remain connected to competence, responsibility, and public confidence. So the message is not that all programs should be identical, and it is not that the CTF should be used as a shortcut. The message is that CTF work should support shared understanding while respecting diversity and keeping quality and public trust at the center of the work. This brings us to initial education. There are some real concerns for the profession across Europe. Workforce shortages and waiting lists are real concerns in a lot of countries, and we need to respond to them seriously. But workforce solutions must protect competence, safety, and trust. Initial education defines what the profession knows, what it is responsible for, and what the public can trust it to do. The future of speech and language therapy in Europe depends not only on how many professionals we prepare, but also on what kind of professionals emerge. We need SLTs with strong scientific foundations, clinical reasoning, ethical judgment, literacy and AI literacy, but also readiness for responsibility. Clinical reasoning develops through time, supervised practice, feedback, and academic depth. It cannot be built only through protocols or short exposure to practice. And this becomes extremely important as our practice is becoming more complex. Future SLTs will need to make informed decisions in varied and sometimes high-pressure contexts. So if practice is becoming more complex, preparation needs to become more stronger and not weaker. Equity is what makes access meaningful. Access asks whether people can receive support. Equity asks whether that support is fair, appropriate, and inclusive for different people and communities. Availability, as you've heard me say before, is not enough. People need services that are appropriate to their language and culture, and also to their disability, and if they have digital access and other personal circumstances. And there are several dimensions to this. One is language. Europe is multilingual, and this needs to be reflected in our assessments, intervention, and also when we decide to use an interpreter. It is also important regarding cultural mediation and resource development. Another element or aspect is disability. People with communication disabilities need accessible information, they need time to communicate, and they also need support in making decisions and access to the appropriate communication support. Third element is digital equity. We know that digital tools can improve access for some people, but they can also exclude people if they assume access to technology, privacy, or digital confidence. There's also geographic equity. Services need not to work only in cities, but also in rural, remote, island, and border regions. I think often the issue is not that people are hard to reach, it is that services are hard to access for a lot of our European citizens. In ESLA, we would like to propose 6 priorities for the future. First, we need to make communication and swallowing more visible in European policy. These issues are connected to health, education, disability, aging, and workforce and inclusion. Secondly, we need better data on need, access, and outcomes. If our work is not visible in data, it is harder for us to argue for investments when we are having meetings with stakeholders and lawmakers. Third, we need to lead responsible innovation. Digital tools and AI should be shaped by clinical knowledge, evidence, and service user experience. Fourth, we need to prepare and support the future workforce. That means stronger education, but also we need to focus on retention, supervision, continued professional development, and just as important, sustainable working condition for our SLTs. Fifth, we need to continue the work on the Common Training Framework as a careful European process linked to competence, quality, and trust. And sixth, we need to put our service users and communities at the center. As you have noticed, these priorities are connected. Policy, data, innovation, workforce, and standards and lived experience need to reinforce each other. So what can ESLA do? ESLA's role is not to replace national associations. We believe in ESLA that national associations understand their own systems, legislations, workforce contexts, and political realities. But ESLA can add value by connecting, supporting, and representing. We can connect countries that are facing similar challenges so that we can share examples, evidence, and learn from each other. We can also support member associations with resources, policy arguments, and shared messages that can be adapted nationally. And we can also represent the profession in European discussions on health, education, disability, and workforce and digital transformation. The aim of ESLA is, one of the aims of ESLA is to strengthen national advocacy with a clear European voice. And we believe that this is one of ESLA's most important roles, to help make the profession become more visible, more connected, and more influential across Europe. But there are also some risks that we need to address. One risk is that innovation is currently perhaps driven mainly by commercial or administrative priorities rather than by clinical need or service user outcomes. Another is that digital tools are implemented without enough evidence, training, or education, or evaluation. A further risk is that AI systems work better for some languages and communication profiles than others, and this is actually creating new inequalities. There's also a risk that workforce pressure leads to short-term decisions that weaken professional preparation. And finally, there is a risk that equity is discussed as an aspiration, but not actually built into the service designs, education, and policies across Europe. And we really need to be honest about these risks because they are only manageable if we name them. So speed is not the same as sustainability, and a quick solution is not always a strong solution. So if we look ahead, the future of speech and language therapy in Europe will require progress in several connected areas. We need services that are easier to access, and we need better coordinated services across different settings. We also need education and continuing professional development that prepare SLTs for complexities, new technologies, and changing population needs. We also need innovation that is evidence-informed and clinically led, and we need stronger involvement of our service users and communities in shaping services, research, and policy. And as you may know or are thinking, this is not a single project or a quick reform. It is a long-term work that will require cooperation between professional associations, universities, employers, policymakers, and again, service users. For ESLA, the task is to support this cooperation at European level and to help ensure that quality, competence, and equity remain central as systems change. So, the future will be shaped by the choices we make today, and those choices are related to how we educate, how we innovate, and how we organize our services and how we involve our service users. Our shared responsibility is to ensure that SLTs in Europe, or speech and language therapy in Europe, remains accessible, equitable, and trusted. So thank you so much for listening to me. And if you have any questions or anything you want to discuss, we will have an open discussion in a few minutes. So thank you very much.
Thank you, dear Sahra. And as Sahra told, we are open for the discussions. As you have heard, a number of serious topics, issues, which every SLT faces almost every day while working with patients or making decisions. So I'm sure you have had some thoughts during these presentations and also welcoming speeches. So I would start the discussion. You can ask from President of Estonian Logopeedide Union, from President of ESLA, and also you are open to discuss with each other as you are all respected and SLTs with experience. So you are welcome, and although the hall is quite small, and I'm sure we can all speak without microphone, so I would love to remind you that all of this seminar will be recorded. So if you have a thought or you want to ask something, you can comment also. Then just raise your hand and Maria would provide you with a microphone. Yeah, Petra.
Thank you, Marja. Hello, everybody. Thank you very much for this, these points for the future. And I think for the common training framework, it is really a very important thing to emphasize on what unites Europe is the diversity we have, which is really clearly shown in language. So this is probably a point, because when we talk to politicians, we very, very often hit a border where they say, yeah, but you are, for example, Belgian SLT and you work in Belgium. What's your problem? You just stay in Belgium. And what do you need any kind of European whatsoever? And I think this is a really, really important thing to say, that it is a unique point being united in Europe, that we have this diversity, which is really evidently shown in the diversity of languages. So thank you very much for your speech.
Any more thoughts? If now I would open.
Well, it can also, if I may interrupt, it can also be ideas because, I mean, this is a brilliant opportunity for ESLA to hear more about what our European colleagues are occupied with or thinking about. So if you have any ideas or pros and cons, I mean, we are more than happy to listen. So, yes, please.
I don't know if Jean-Laurent is from France. I don't know if it's a question or a remark, but it's about, yes, being part of the European Association. I think it's our role to think about how we are working or what is the field of SLT, even if among different countries it may vary from one to another. And I think that the question of the common training framework is a real question addressed to the European Association, and I think you represented it well, because it has to be something that can be us all united, but respect also diversity. So the only thing that I wasn't sure about is that I wouldn't define it as a minimum common denominator. It can be thought as something maybe strong, and maybe national legislation can adapt to this, but we don't have to think it as a minimum. That's just what I wanted to say.
I think that's a very important point you're making there, Jean-Laurent, so I agree with you. And I definitely think that that should be a common, focus for us in ESLA. And I believe it's good to have ambition. So if our ambition is, to inspire other countries with the common training framework, I definitely think we should work towards that. And I know you're part of the Common Training Framework Task Force, and are you doing a brilliant work with the rest of your colleagues. So we are looking very much forward to hear more about the work you're doing in that group. So thank you very much.
Yes, Piros.
Can you hear me? Yes. Hello, everyone. Thank you for the presentation. I have a question and comment. This CTF Common Training Framework, how is the ESLA has thought of it? So it will be implemented as a European framework, or it will be focused more on keeping and focusing on our professional rights? And what would be the role of its association on this?
Well, those are three big questions you're asking there, Spiros, and we only have 10 minutes left. And I think those are really important questions. And to be honest with you, I don't want to reply to those questions on my own, because I know we have a brilliant work that is going on in the task force. So those members of the task force who are present in the room, and I want them to, reply to these questions together with me, so that I know that our questions or our answers are based on the work that they're doing. But in my opinion, I think this common training framework can have different purposes. So it can also be, used as a policy framework in our discussions with the European Union or the MEPs across Europe, but also believe at a national level, as Jean-Laurent also pointed out, that this could be used by the local associations to improve the requirements in their countries. Because, as I mentioned in my talk, the role of an SLT is quite complex these days. So if we want our future SLTs to, be able to make progress and to be able to develop the profession, we need a very solid and fundamental grounds of education in order to be built up on that. So the fundament is very important for the future of the profession. So was that enough for your questions, or I will be more than happy to elaborate on them with our task force. Yes, thank you.
Any other comments? Questions?
Thank you, and hello to everybody. I would like to think with you about keeping SLTs on the field throughout their career, and to think about it, how to support them, whether they would like to change their field inside our own expertise, yes, whether we come from health to education or vice versa. Could there be some framework for this also, how to support those SLTs and how to keep the skills and the diversity levels equally when changing the field inside our own education? And could the common training framework do this also, or should it need some more frameworks?
Thank you for this brilliant question. And when I heard you mention the question, I mean, there are so many different themes in the question or the concerns you're raising, because retention of SLTs, for instance, I know there have been studies from a global perspective where we looked at the retention of SLTs, and this is actually a profession where there are SLTs who decide that they don't want to continue. And the reason why they don't want to continue often has to do with burnout, complex cases, lack of opportunity for professional development. So yes, regarding those elements that I've just mentioned, I really believe that those are things that we need to address in ESLA as well. Relating to your questions, I mean, if this is something the Common Training Framework should incorporate, that's a good question, and I think we can, take this into consideration in the future work we're doing. But when we meet with MEPs, we do, make a huge effort, describing the critical role SLTs have for patient well-being, even for patient safety, if you're dealing with swallowing disorders. So, and this requires, ongoing professional development. So definitely we are raising this question at a European level, and we will continue doing that. And we are also very, very much interested in helping the local associations as well, in drawing a framework for how to, be able to reach their goals.
Any more hands? If not, I will raise a topic about equity. I understand we have only 5 minutes and the topic is huge. We all SLTs agree that everybody who is entitled to get service has a right to service in one hand. And on the other hand, we have too many patients and lack of SLTs. So I think every SLT is at one point in the place where he or she should make a choice who to help. Whether the patient with more serious problems deserve more help, or maybe should be helped a child with a very mild problem. So it is a question, I guess it is $1 million question if somebody could answer it. But in every country, I suppose, in Estonia, we have that issue, how to, as we can't produce more, I think it is now right word, we can't produce more SLTs than we are capable. But the amount of children who need help grows, scope of the profession grows every day. Now we have also prevention, multilingualism, topics we didn't maybe had 10 years ago, 15 years ago. So what would be the good golden fish? What could golden fish say about that?
I think that could be a PhD dissertation, because that's such an important question you're asking, Helge. And I think it also has to do it has to do with ethical considerations too, because the questions that you're raising, I mean, the example you gave in the beginning deals with ethics. And who is responsible? I mean, is it us as SLTs, or is it the lawmakers, the decision makers who have provided us with the resources in order to, be able to provide services? So I'm afraid I don't have an answer to the question, but I do recognize the challenges. And I think there is not one single solution to this concern that you have raised, Helge. I think there are different perspectives that we need to address at the same time. So I think, I really hope I don't sound like a politician right now, but this is something that I definitely think that we will continue to look at in ESLA too, because because we talked about burnout before, and one of the reasons for burnout is also that SLTs need to make these tough decisions. So who should I treat and who should I not treat? And if you're a physician, your decisions could be a matter of life and death. But if you're a speech pathologist, I also believe our decisions could be a matter of the well-being of the patient and not. And with the crisis we see across Europe with young people having mental issues, who are not going to school, who are having, dealing with mental disorders, disabilities. So I really think that this puts us again in a very complex situation that we don't have any simple solutions to. And that's why I think being in this room together with so many professionals is the way forward, because this is where we can, raise these questions and inspire each other, because I could go on, but I think the intervention here could be on different levels, because it's also about giving the individual SLT the resources and the capability to be able to deal with these ethical considerations. And then there's the political work as well, to make the lawmakers and stakeholders, make them aware of the situations that our citizens and service users are in. So I'm afraid I have to disappoint you, Helge, but...
No, you didn't, because I knew that there is no correct answer. But why I raised it, as it's time for coffee, maybe it could be one topic you can discuss between yourself, drinking coffee and enjoying the perfect environment. See you back in 20 minutes. Now we are going to continue, and I'm really excited because this half of the seminar, how to say, well, it makes me proud. I'm proud to be Estonian. I'm proud to be alumni from Tartu University, because it's the greatest university in the world. And I'm thrilled to welcome our next presenter, Marja-Liisa Mailend, who will tell you how great we are. Her topic is the future of speech and language therapy in your, research highlights in speech and language therapy from University of Tartu. Here you go.
Thank you, Helja. Well, it's a great honor to be here. Welcome for everybody, guests from abroad and colleagues from Estonia. I will indeed try to continue where Helja left off, although I'm not sure where there is to go after the statement of greatest university of the world, but I indeed hope to convince you that it is a wonderful time in Estonia to be in this field, because there is a lot exciting going on, and I think things have changed very rapidly, and we have gotten somewhere where there are achievements that one could be proud of, and without doubt, the directions in which to go are much wider yet. So let's travel through that a little bit together today. I wanted to give you a very brief overview of my background because I think it gives a little bit of context for what I'm going to say and explains my perspective on things. So I graduated actually from the University of Tartu after finishing a master's in speech-language pathology and special education in 2009. And I had a little bit of an experience during my master's program doing research under the direction of Aaro Toomela, who Estonians I'm sure know at least. And I discovered two things. One of the things was that I was rather dissatisfied with the tools that we had as speech-language pathologies and language-specific knowledge to do the work that we do. Most of the knowledge that we had was experience-based, like valuable experience-based, but nevertheless there was very little research. And in addition to that, I had to look outside from Estonia because there was really no research going on in the field of speech-language pathology in 2009, and more importantly yet, there were no advisors for me in our specific field. So I went pretty much as far as one could. I went to the beautiful Sonoran Desert in Arizona. I started a PhD program at the University of Arizona, graduated that in 2017, and then decided to do a postdoc in Philadelphia in the Mass Rehabilitation Research Institute. And then the pandemic came, and I realized that much of the work that I used to do in my office, I'm doing from my desk in my kitchen, and probably it doesn't matter anymore what geographical location I'm sitting in. So currently I'm employed at the University of Tartu as an associate professor, and at the same time I continue directing a speech and language recovery lab at the Jefferson Mass Rehabilitation Research Institute. So, I think we are in a wonderful place in speech-language therapy in so many ways right now. I know that many of you, for example, had the pleasure of being in the audience at the Baltic Speech-Language Pathology Conference, where Anna-Liisa Sutt gave a remarkable and uplifting speech about where we have come as a field in the last decade and a bit, especially when it comes to medical speech-language pathology. So many things got also mentioned by Keiu just a moment ago, and there are also these many things that have been wonderful in Estonian speech-language pathology for decades that are now in danger because everybody's counting the pennies very carefully, and sometimes it's not obvious that things that seem expensive right now actually would be much less costly in the long run. So we have a job to do to protect those things that are really quite well. But my talk is going to focus on research. So as I mentioned, when I left Estonia in 2009, there were people with a PhD in our department, but their work was focused on special education rather than speech-language pathology. The picture is very different today, merely a decade and a little bit later. We have 3 PhD level scientists in the department, and more importantly yet, there are 5 PhD students. Liis, who is Liis Temas, who is on the left, I am counting as one of ours, even though Virve might object. We are sort of sharing her, but her area is in developmental language disorders, so I think we can claim her. And Marika Padrik, the person on the up left, is one of her mentors, so at least one of her feet is in our department. Then again, next to her is Marju Lahtein-Kürsa, who is also getting quite close to graduating. Anna-Maria Ylviste in the middle, who is sort of in the middle of her program. And then we have 2 brand new doctoral students, Maarja Maripuu and Siri Niine, who have started just this year. So, unfairly so, obviously all of these can give you their view and their research program, but I'm going to be focusing on things that I am directly involved in because I know most about them. Current projects. So as I mentioned, we're really still today in this place, even though we are starting to have the manpower, we're still finding ourselves in a place where much of the tools that many of the bigger languages are enjoying having, we don't yet have. And one of such things is the understanding of articulatory and phonological development in Estonian-speaking children, particularly from the speech-language pathology point of view. When do we expect Estonian children to acquire certain sounds, certain syllable structures, and so on? So we found an opportunity to apply for funding and started a 3-year project thanks to the successful funding situation, with some of the faces that you have already met from my previous slide. So I have a wonderful team to be thankful for, which includes 3 doctoral students, 3 master students, and 3 bachelor students. So hopefully growing more people who are skilled in research in the project as well. Our goals with this particular project were indeed, as I mentioned, to characterize the development of speech sounds, syllable structures, phonemic quantities based on a representative sample of 3 to 5-year-olds. Obviously, the reason to pick this age range is because this is when we most need to know, should we start to do something or should we sit and hope that things will pass? But there are reasons, of course, to look before and beyond this age group. We also wanted to start looking at speech sound profiles at age 3, which predict a speech sound disorder at a later time. So our 3-year study is, for the most part, a cross-sectional study, but we also include a longitudinal study to follow some group of children more specifically throughout the duration of this grant. And our final, but not least goal, is to develop a comprehensive assessment battery for characterizing Estonian speech sound development. I want to make sure that I don't overpromise here, having many of my colleagues in the audience. Obviously, this 3-year grant is not going to end with a standardized ready-made test, but I think we will make a very big step in that direction and hopefully can continue that work. So we are aiming to get a sample of 400 children, a representative sample, so across Estonia in the age group. I have to say that so far the data collection has gone really well because the need for such knowledge as well as such materials is well recognized by speech-language pathologists, and we are really met with eagerness to participate in the daycares that we have contacted so far. There have been only very few daycares that have had good reasons not to participate. So in that sense, this ambitious number is starting to look a little bit less ambitious. We have planned 2 waves of data collection. One is complete. I'll show you the numbers in a moment, and the other one will start in the fall. And as I mentioned, we have collected the largest number of 3-year-olds in this first wave with the idea that we will identify the participants who are half a standard deviation or below the mean, or less below the mean. And this is then the group that we will hope to test again in another 2 points during the time of the grant to have some developmental data. Our main task, obviously, is naming, as this is the first good glimpse into the seeing the development of speech sounds. We are really happy with the material so far because we managed to get a really great artist who is working with us very intensely and is really great at making drawings that children love to look at, but also clear so that we get good name agreement on these items. But there are other tasks that we have included because developing just the norms is not exciting enough by itself, right? We are trying to understand a little bit the psycholinguistic mechanisms of the problems when we see them. So the number of tasks is quite a few to be able to detect these things. We audio and video record these samples, and then comes the transcription part. Where we are right now, we have 254 children recruited into this study from 33 daycares across Estonia, and we are busy analyzing the data, marking it in various ways, including in IPA for the further analysis. But currently, I don't yet have any actual data or actual results to present to you, hopefully next time. This quickly brings us to the next project that is nearing completion, actually, which is spearheaded by my doctoral student, who I mentor with Marika Padrik, Marju-Lahti in Kürsa. We have an interesting project that looks into the language-specific features of Estonia in childhood apraxia speech. And we first completed, because Marju started when COVID hit, we had to change courses and not get to see any children, but had to, in another way, continue with her work. So we decided to do a survey study where we picked one language that is similar to Estonian, that being Finnish, and one language that is quite different, that being Lithuanian. And we asked altogether 197 speech-language pathologists about 63 possible features of childhood apraxia speech, and did some analysis on the responses. I'm not going to go through this complicated graph in too much detail, and sadly I don't have a pointer, but one of the interesting things that emerged from this data is that in addition to some probably culturally led differences in how we approach this disorder, there are clearly some language-specific features in here as well. For example, Estonian uses palatalization, but typically not phonemically. It typically doesn't change the meaning, only in a few cases. Lithuanian, on the other hand, uses it phonemically and uses it a lot. And we see that the Lithuanian speech-language pathologist actually observed this more frequently, this problem more frequently in childhood apraxia speech, something that is obviously not detectable in literature in English because that is not a feature of English at all. And same with Estonian, where we have this complicated quantity system where we say that it's a sound length that distinguishes meaning, even though there are more aspects to it than just length. And we do notice, at least the speech-language pathologists that reported to us do notice errors with this aspect of Estonian, even though not as frequently as we expected to see that. So we decided to look into this empirically. And in this current study that we are finalizing at the moment, we had children produce non-words that belong to these 3 different phonemic quantities. So in Estonian, we have the first quantity, mume, and then we have 2 other quantities, longer quantities, muume, or in the first one, mumme and mumme. And in this case, the consonant is what carries the length. It can also be the vowel. So the second quantity could also be muume or muume. As one could expect from the theoretical perspective at least, the children with apraxia of speech might have trouble with this fine distinction in length. So Mario collected 16 children with childhood apraxia of speech. We had rather strict criteria in how we identified these children. 46 children that we eventually classified with other speech sound disorders, and also 25 typically developing peers. And as I mentioned, it was a repetition task of non-words, much like the Mume example that I gave, but it was given in a child-friendly context with some story going with it. But to mention the results only briefly, we did see a very clear distinction in children's ability to differentiate between these quantities for typically developing group and the childhood apraxia of speech group. There was also a statistically meaningful difference between the other speech sound disorders and childhood apraxia of speech, although there are some people in this group, in the middle group, who also show difficulties with quantity. And part of the problem might be here that we really did use a very strict grouping strategy for including children into the childhood apraxia of speech category. If we had any doubt, they went into the middle category, which might be part of the story here. Well, we'll know more soon. And finally, as I have just a minute left, I wanted to quickly mention another project that we are taking on at the moment. So since my primary work has been in adults with stroke and aphasia and apraxia of speech, our new project is going to be developing a material and understanding of word retrieval in aphasia with apraxia of speech. And this is spearheaded by my brand new doctoral student, Marja-Liisa, and also Merje Viigand and Eva-Margareeta Päts, who is a master's student. Merje is my colleague in Tartu. And again, we will be looking at language-specific factors that influence word retrieval in aphasia, but the most interesting aspect, again, we will look at the usual suspects, the word frequency effect, the phoneme length effect, which there is no reason to believe that it will be much different in Estonian. But in addition to the morphophonological complexity that I just talked to you about with changing quantity, there is also a very complex system of cases. In Estonian, we have 14 noun cases in Estonian, where not only the length can change when you turn one word from one case to another, but also the stem itself can change. The sounds in the stem can change. And that, I believe, is something that we need to really look into it, how people with aphasia manage with this kind of complexity. And some other goals. I will leave it at that for the moment. Happy to answer any questions, I understand, after Virve's talk, right? So thanks very much for your attention.
And now I will invite to the stage Virve-Anneli. And again, I'm happy that she answered to my proposal and came here today. Both of the presenters, I must say, have changed the plans to be here with us. So Virve-Anneli will probably introduce herself. But she's a Dr. Virve-Anneli, professor of psycholinguistics at the Tartu University also. And topic is speech and language therapy in a multilingual context.
Hello, everyone. I'm really delighted to be here, delighted to see all of you here, to welcome you here, and myself to be talking in the Parliament building. That's quite an honor. So thank you for inviting me, and thank you for coming. I'm a linguist, and my main interests are in language acquisition and multilingualism. But I also have projects that are much less related to what we're talking about here today, looking at youth language in Estonia and other things. So my training is not in speech and language therapy, but it's been a real privilege of my career to learn quite a lot about this field through working with wonderful colleagues in the world of SLT. So I'll talk a little bit about that. It's also funny to be coming at the end of the day and wanting to give you, sort of step back and giving you some background about the language situation in Estonia. So I'm going to, I'll show you the next slide. Maybe the first half of the talk, I want to talk a little bit about languages in Estonia and the educational system, the language situation in the educational system. And then I want to tell you about 3 projects that, just like Marja-Liisa, I want to talk about the projects that I myself am involved in, both to give you a sense of, well, to introduce the projects, especially for those of you who are working in Estonia, but also as a sort of case to talk about what is needed and what more is needed. Of course, I think that's come out through the rest of the talks today as well, that there's been a huge amount of progress in Estonia and more broadly in speech and language therapy research and in services, but there's a lot more to do, as I think all of you know well. So I'll talk a little bit about multilingualism in Estonia, about just a tiny bit about bilingual development and bilingual language assessment and support in order to give background for talking about 3 projects. One is a bilingual assessment tool that we've just completed here in Estonia. Talk about a project that was involved with teaching materials for slightly older children, and then the Center for Multilingualism that we've recently established at the University of Tartu, the greatest university in the world, as we now all know. I'm really pleased that that's already been established, and then finish with some concluding thoughts. So, you may have already figured out that Estonian is the main language spoken in Estonia. It's the first language for about 2/3 of the population. And the largest minority languages spoken here are Russian, first of all, for more than 1/4, less than 1/3 of the population, the first language. Second, first language is Ukrainian, followed by Finnish, English, and Latvian. So, of course, neighboring and bordering nearby countries, as well as English. But there's been a really large increase in the number of first languages spoken by people in Estonia in the last couple decades. So, currently, there's over 200, probably by now about 250 first languages spoken, which is more than double the number that came out of the census conducted in 2001, I believe. As well as, I think it's important to mention that there are indigenous but not recognized languages, especially in South Estonian, different variants of South Estonian. And another really important issue in today's educational landscape is that it's undergoing a reform in the language of instruction. So previously, Russian medium and bilingual schools are shifting in a relatively rapid way to Estonian medium education, and that's happening for basic schools by 2030 and for all schools by 2032. I'll give you a little bit more detail about that. But in general, because of this, as well as other reasons, schools are accommodating much more heterogeneous student bodies. And I know that's familiar from other countries in Europe as well, but I think that's especially acute here in Estonia. And in addition to all of that, there's a really high proficiency, especially among young people, in English. So the Soviet legacy was that there was a parallel school system with Estonian medium schools and Russian medium schools. And the current situation is that there really is increasing diversity in Estonian society and in Estonian schools, and part of that is because of immigration, part of it is because of the move towards inclusive education, because of parents increasingly enrolling their children in Estonian medium schools, regardless of what their home language is, as well as the huge role played by the reform that I mentioned. So in 2022, following the full-scale invasion of Ukraine that same year, the parliament here decided to implement the full transition to Estonian education, which had been under discussion and sort of planned, or not just under discussion. The decision to implement this had been there for decades preceding this, but among other political priorities, it hadn't been pushed in the way that it now has been implemented. So now schools are undergoing a gradual transition to teaching fully in Estonian, starting the academic year before last, from 2024, and as I said, it's going to be complete on all levels by 2032. And while this is a national level decision, and the general plan is on the national level, local governments control details of implementation, so there's quite a lot of difference, both in terms of how much of the population is non-Estonian speaking in different areas of Estonia, as well as how this is being implemented on a local government level and on an individual school level. So there's quite a lot of heterogeneity at the moment in the Estonian education system. In basic schools, about 30% of the students are studying in a language other than their home language. Mostly, we're talking about Russian L1 students, but also other languages, as I've mentioned, and less than half of those were studying in Estonian medium schools, more than half in Russian medium schools. These days as well, on the preschool level or kindergarten level, parents have a choice of what language educational institution to put their children into. A really important fact or part of this law is that parents and children have the right to ask for support with the child's home language, and if more than 10, or if at least 10 students with a first language other than Estonian are interested, then the local government and the school has to offer some sort of access to language and culture studies. I'm not sure how well this is known among parents of bilingual children, and I think this is something that actually should be much better advertised, and support should be offered to parents to both be aware of this, understand why it's important to also develop the home language, which not all parents understand in multilingual situations, and to actually provide easy access to this sort of thing. So about bilingual language development, I kind of think that most people in this room are very aware of the differences between monolingual and bilingual children, but it's worth reminding ourselves that it's not just input quantity that's different for multilinguals, but also generally that comes along with a difference in what we call input quality, which isn't, quality doesn't refer to whether it's good or bad, but how diverse it is in terms of linguistic structures and so on, in terms of numbers of speakers, in terms of in terms of the variety of contexts that children have access to, which also has implications on their vocabulary development and so on. And so because of these things, bilinguals have generally the same milestones as monolinguals, but often along a different sort of time scale, and the two languages can develop along very different time scales as well. And it's important to remember that bilingual children, multilingual children, are much more heterogeneous in terms of their background, their language exposure to each of their languages, and hence also their language skills. Schools in Estonia are operating on the principle of inclusive education, and bilinguals are now to be designated as students with special needs, which has an impact on the work of speech and language therapists. Of course, they are not trained as second language teachers, but often that line gets blurred, I think, in kindergartens and also in schools, and clearly there's an increased need at this point for better assessment, more interventions, a more complex set of knowledge and skills that are required of both teachers and SLTs. I think that's come up a number of times already today, and an increased need for learning and teaching materials. Schools have a really sort of crying need for more language teaching support as well as more SLT support. My slide says or both, but I think the real answer is is both of them are important. When earlier, and to some extent, sometimes even today, bilingualism was seen as a risk in and of itself. I think the general consensus these days is that bilingualism in and of itself is not an issue, although I have to say I know from personal anecdotes that this is still a message that's sometimes conveyed to parents here in Estonia and in other places, that if a child is having speech and language difficulties, then perhaps you should stick to one language. And this causes a whole new set of difficulties for families who are multilingual or families who are speaking a different language at home than the language of the society. And so that in and of itself is also an issue. Typically developing children who join the societal language or who begin learning the societal language in preschool or kindergarten generally can acquire enough Estonian as a second language there to continue with their L1 peers in first grade. Of course, that's also not guaranteed because this depends to quite a large extent on what the makeup is of their group at preschool, what kind of input they're getting at preschool, what kind of support they get at home for Estonian language learning, and so on. I'm sure this resonates with a lot of people in a lot of different countries. But of course, not all children find this to be equally easy or seamless, and what I've been most interested in is children with developmental language disorder, long-term systematic language delay, meaning that they're not acquiring language as expected in the absence of other biomedical conditions, and this affects both of their languages, both the home language and the second language. And generally, this is explained by language processing impairments. So the assessment instruments that SLTs generally have access to are usually normed on monolingual populations, and this, of course, is risky for assessing bilinguals. Maybe this is sort of common knowledge, but I think it's really, really important to realize that this leads to a risk of misdiagnoses with bilinguals that can both overdiagnose and underdiagnose DLD, developmental language disorder, and that really underscores the need for assessment tools for bilinguals that are normed on bilinguals, and of course preferably that are accessible in both languages. I'll actually pause here to say that I think that's one other aspect of what a European-wide body can speak to is providing access to materials in different languages that within one country may not be feasible to develop, but if they're normed on bilingual populations that have similar enough sociodemographics, that actually could be something that really, really supports SLTs supporting multilingual populations. And of course, SLTs need training in bilingual assessment and support. It's not all the skills that are needed for supporting multilingual children come naturally with the education and training that SLTs have otherwise. So I'm going to talk about 3 projects, but mostly about this first one. Before I do that, I want to just sort of highlight that there are at least 4 different groups that we need to be thinking of, and that in a multilingual context really need additional access to knowledge, to skills, to communication, to awareness, and to support. And these are, first of all, the children, of course, who either come to an educational institution with 2 languages or find themselves in a situation where they need to learn a second language. And really ought then to have support for both languages, either in the school or outside the school. Parents who really, as I already mentioned, don't always have the knowledge or the awareness of what sort of support their children need, and don't always have access to communication with teachers or SLTs in order to better understand what their children are going through, where their children need more support, and how their children are doing, what sort of and what they can do to support their educational and linguistic needs. Then, of course, SLTs, who I think often need additional knowledge, additional skills, and additional tools for working with multilingual kids. And finally, teachers who often don't have as clear communication channel with either the SLTs or the children's parents as would be ideal for providing the sort of support that they, of course, want to provide. So the 3 projects that I'm going to talk about address each of those in slightly different ways and to different extents. So the first one is about identifying developmental language disorder in bilinguals. And in Estonia, we do have standardized tests for identifying disorder among monolinguals. 2 of my colleagues who have developed these tests, Marika Padrik and Merit Hallap, have both been mentioned today. And you saw Marika Padrik's picture in Marja-Liisa's slides. But until now, no tests were available for children learning Estonian as a second language. Identification of disorder, impairment, and assessment among bilinguals is complex. It has to be based on a combination of methods, but up until now, it's been quite subjective and quite difficult without tools, and it depends to a large extent on the experience of the speech and language therapist. So this is problematic, as I mentioned. Misapplied norms and assessment generally tends to be based on this child's, or it's problematic when it's based on the child's second language or weaker language, namely the school language. So speech and language practitioners who lack knowledge and skills can very understandably misdiagnose bilingual children. I wanted to mention that in the pilot study that we ran with sentence repetition task that I'll show you in a moment, almost half of the bilingual group that we included based on SLT assessments turned out to be overdiagnosed. So turned out, based on when we looked at their home language, which was Russian language skills, they were completely within norms and were reassessed after that. That's quite a large percentage, and we also found examples of underdiagnoses as well. Difficulties with the second language can be related to impairment. They also can be related to simply, short or limited exposure and slower development in the second language. So, together with Marika Patrik, we have developed an assessment instrument that is based entirely on the tasks that the Litmus international network that some of you are probably connected to developed in their wonderful work on language impairment in a multilingual society. When we started developing some of these tasks in Estonian, and somewhere along the way, were offered the chance to apply for funding from the Estonian Education and Youth Board, and then that turned into a much more broad-based and complete project. So from 2021 to 2024, we actually completed the adaptation of these tasks into Estonian. We developed a fun acronym, so it's called Kalake, which means fishy in Estonian, and it stands for Bilingual Children's Language Skills Assessment. It's really exciting to be talking about it right now because we've just completed the very first round of training for speech and language practitioners, which took place in May, and we'll be having the next training sessions in the autumn of this year. So it's actually up and running now. The aims were that it could be administered easily in a preschool setting. It doesn't rely on complex linguistic analysis, and that it would be an appropriate level for typically developing children and distinguish between DLD children and typically developing children. We've normed it on 456 children aged 4.5 to almost 7. So basically, it's a test for 5 and 6-year-olds, and it's composed of 3 main tasks: 2 repetition tasks and a vocabulary task. The non-word repetition task, sentence repetition task, and cross-linguistic lexical tasks. The cross-linguistic lexical task at the top right corner, they're very simple naming and selection tasks, so both production and comprehension with nouns and verbs. There's 4 subtests, and that just gives us a easy, good understanding of linguistic knowledge. The other ones tap into linguistic knowledge to some extent and language processing. So the non-word repetition task, which is similar to what Marja-Liisa was talking about, assesses phonological representation, phonological memory, and we've used the language-specific section, which worked best compared to the universal language, non-language specific section. And the sentence repetition task is more difficult, depends partially on language knowledge, but partially on language processing, and because it involves the decoding and reproducing of language structures. And we have both clauses that are cross-linguistically challenging and clauses that are challenging in Estonian. And we're really pleased that we also have, alongside the sentence repetition task in Estonian, we have we're able to include in our test battery the Russian language sentence repetition task, which is clearly the most relevant other language task that was developed by Natalia Mir and colleagues. And it measures the same skills as the sentence repetition task in Estonian, but in the home language. So having the two of those greatly increases both the sensitivity and specificity of this task and makes it very useful. Mostly we've had really positive feedback from the children as well, some of whom don't really want to finish when the task is over. And we have these fun, cute characters who are used in the task. And the cross-linguistic lexical tasks, I'm sure some of you are familiar with these. As I said, there are 4 different sections, nouns and verbs, and comprehension and production. And that brings me to the end of that part. So I'm happy to answer more questions about those if you have them. How much more time do I have?
2 minutes, but...
Yeah.
I guess we can give her as much as her needs.
I won't take too much more time. That's okay. So this the project on developing teaching materials is geared towards teachers, but I think I wanted to mention it because it's an example of the fact that the Estonian funding bodies who are looking for what are the crucial topics that need addressing, especially in this great language reform in educational institutions, have identified that not only the support for language teaching needs to be increased, but also specifically children with language impairment who are learning in a language other than their home language. So this was a project that is in collaboration between Tallinn University and the University of Tartu. It was funded by the Ministry of Education and Research, and it's specifically for bilingual children with special needs. Who are studying in the 5th grade, and it recognizes that there's a compound need for extra attention among these children, and it was a short project. It only lasted for 2 years. We had a lot of classroom observations as well as interviews with teachers, comparison with the situation in Finland, visits to schools in Finland. And I have to say, it was really, really interesting to speak with teachers and hear their level of knowledge and awareness about how to identify children, the heterogeneity among teachers in terms of how much knowledge they have, how much information they have about which children are being offered various kinds of support, and what they can do to support these children in the classroom, how to differentiate and whether their theoretical knowledge translates into practical knowledge in the classroom. So we developed samples of teaching materials as well as a guide for teaching in heterogeneous classrooms, and specifically focusing on developing the concept of language awareness and how to teach in a language-aware way, which of course supports both monolingual children and children who are studying in a second language, and children who are studying in a second language with various special needs. So that was a useful project, but it also is very narrow, specifically for math and science in the 5th grade, and sort of makes you even more aware of how much more need there is for more teaching materials and more knowledge and more guidance for teachers and more support. So that was quick. And the final one will be even quicker. I want to talk this is even more general and less related to the field of speech and language therapy, but because of the rising awareness of and increasing multilingualism in Estonia, we've just opened a year ago, a Center for Multilingualism at the University of Tartu. And this is not a research center, it's a center that aims to be an information hub for society at large. So really to translate research results to parents, teachers, children, SLTs, raise awareness about multilingualism and develop various kinds of channels for public engagement to disseminate knowledge and research results and bring researchers together who are working on similar things. Just putting together two brochures that you can, sorry, not two brochures, two examples are on the slide, but we're putting together brochures to start with about 6 topics. So we have multilingual children, multilingual people, multilingualism in society in Estonia, and so on. Some of them are more related to the school setting, and others are more general. And we've got a series of events geared, some of which are geared more towards teachers, and some of which are geared more towards the general public, and so on. But in any case, those of you who are in Estonia, definitely write us and sign up for our newsletters. Then you'll be kept informed of all the events and information materials that we'll be producing there. There's the email address and website and so on. And we're part of the Bilingualism Matters International Network. So this is a new thing, and it's another example of how a sort of spotlight is on multilingualism, multilingual development, and how much work there is to be done in this realm. And so my final thoughts to pull this all together. These are examples of projects that are being done. I think I'm very happy that to have been involved in them, but to take a broader angle to finish with, I think not only we need more research, of course, but I think we're at a moment, certainly in Estonia, and I think in a lot of other places as well, where there's sort of a bridge or we need to form a bridge between earlier conceptions of what multilingualism is and how it affects children's learning and how it plays a part in the functioning of society. And these are examples of stakeholders who can help be part of that bridge, but who themselves don't always have all the knowledge, skills, tools that they need to best perform that bridge function. So teachers and schools need awareness and skills, of course. They also need really strong communication with families, and I think that's something that can be developed. We also have a research project in my institute which is specifically investigating the ways in which schools communicate with families, especially families who are undergoing this language reform and who are raising multilingual children. Parents need to better understand their role as well as have access to information and understand why it's important both for their children to learn the societal language and to develop and support their home languages. And of course, SLTs need diagnostics in both languages, preferably more than just Estonian and Russian. Need skills in assessment and intervention for multilingual children. And it was mentioned at one point earlier, but access to interpretation for heterogeneous first languages is certainly something that hasn't been massively developed in Estonia. And finally, just more generally, I think, at the moment where we're at in Estonia and more broadly, there is a need for more knowledge, more attention to multilingualism, communication and positive attitudes, both among parents and among teachers and other educators, about the positive aspects of multilingualism, the need to support both languages of children going through the educational systems, and availability and access to tools and support. That brings me to my final slide. So thank you very much for listening and for the extra minutes, Helja.
I want to thank you both for these interesting projects you are conducting. The projects, when they are finished, they will help all the SLTs, but through the SLTs, all the Estonians will benefit for your work. Thank you. And now we have time for questions. So microphone is going to move around. Just raise your hand. I saw Spiros already did it. And yeah,
I have some comments, not exactly questions, for both speakers. But let's start first with multilingualism. It's my expertise. I commend that I have seen that the multilingualism, the Center for Multilingualism, well done. That's a very good work. And also, from my surprise, I have seen that you're teaching in schools, apart from the language, the cultural, which is impressive. As you know, the multilingualism, the children with multilingualism, if it's not taken into account cultural environment and all these habits, it leads to cultural pragmatics. The recent research exhibit. What I wanted to say is that at the ESLA, at the moment, we are having a task force about multilingualism. We aim that to have a position paper about multilingualism in a European level, and apart from this, another aim is to gather and even if not to create assessment material or whatever material will be in European level for multilingualism, as exactly you said that there is no assessment at the moment tool for its language. And assessment, as you raised, it should be done ideally in every language. So we are more than happy to collaborate on this and share some ideas and gather all these materials. Also, ESLA is part of a project between Cyprian and Greek schools with 2 universities in Cyprus and Greece. ESLA also participates on approaches about teaching multilingual children in schools between SLTs and teachers with children with DLD. So we are more than happy to share you the results and after that. And what else? I also wanted to say that, as you mentioned, that recent research exhibits that children with DLD, multilingual children with DLD and ASD, it's not a barrier, multilingualism in those children. It's not a barrier, but instead, and recent research in Greece and other countries exhibit that even if they have, after therapy intervention, they have the same level of language acquisition and communication, if not better, especially ASDs, autistic children. That's my comment and question. And I have another.
Can I? Oh yeah, the microphone works. Thank you so much. That's great to hear. Thank you for offering collaboration. I'm interested in talking more. I wanted to comment on your comment on the language and culture courses, because in theory this is a wonderful idea. I agree, and it should be together. But in practice, what this means can be very different in different places, it can be something like a Sunday school type of support, and how many hours it actually means, and how easily accessible it is in places outside larger cities and so on. Can be varied, and whether or not there's a greater emphasis on language or culture depends to a large extent on what teachers or mentors are available for these things. So, and like I said, my concern is actually that a lot of parents either don't know that this right exists at all in Estonia because it hasn't been there for a very long time, and second that even if they know, not all parents understand the need or the why it's so important to take advantage of that sort of thing. So, yeah, I agree. It's good, but this is the theoretical theoretical side. Yeah. Yes.
Thank you. Hello. I have a question, and congratulations on the amazing work you're doing at the world's best university. Now we all know that. I mean, there are small countries in Europe where it's quite difficult to find funding for research projects or even to create assessment materials that are language specific. So, I mean, you're both researchers. So what kind of advice do you have for those countries who have brilliant SLTs, who really want to be involved in research, but it's so hard for them to get the funding? So from the researcher perspective, how do you gain funding for the research? But also, if we have the time, if you could elaborate kindly on what kind of a collaboration that could be between researchers, national associations, and in the end, ESLA. Thank you.
Yeah, that is definitely true. With much less than 1 million speakers, it can be very hard to convince the funding bodies that this is worthwhile. But I think one of the things that we are in a lucky situation with is having a language this unique. It's so unique in so many respects that I think for theory development, it's not only our community who has something to benefit from this. And I try to make sure that I always put that forth. As to the other aspect of, well, in Estonia, we're also lucky in the sense that the need to preserve our language is written into our constitution, and in the context of Estonia, it's not important. It's not difficult to convince that this is important. Of course, the moment we need to look outside of Estonia, and typically we do, it becomes your job to argue and exactly show why this could be interesting for a wider public than just for our local pond. In terms of collaboration with speech language therapist unions, I would say that in Estonia it's sort of inherent. We all come from the same university. There is a lot of crosstalk and knowledge about who does what where. But for the broader picture, I don't think that science in speech-language pathology can be done meaningfully and well without the practitioners. They have to be collaborating. We have to be collaborating with them, and vice versa. Otherwise, it's the gap that we know exists and knowledge between research and practice is not going to go away on its own. That needs to have direct work. And that's, I think, where absolutely we have ample opportunities for collaboration.
I'll just add to that. I think there are European level instruments like the cost networks, which have been wonderful. I mean, the litmus tasks, for instance, grew out of one of those. But those of you who've participated in those know that there's funding there for mobility and bringing people together, which has huge impact. It's really, really beneficial. But there is no research funding. And so how much each participant is able to, contribute and also benefit depends usually on additional research funding that comes from elsewhere. It can sort of fuel proposals for grants and so on in the individual countries. And some things can be done without funding, like we started developing the sentence repetition tasks in Estonian and the non-word repetition tasks without any funding. Luckily, we received funding because we wouldn't have been able to carry out all the norming that we've done without that. But there is a certain amount that can be done within, you know, within the jobs that people are doing anyway. But I agree that through collaboration, you can sort of expand what you're able to do with languages with smaller speaker communities. It is a challenge. I agree, it's a challenge, and I do feel very lucky that in Estonia right now there is even the amount of funding that we've been able to procure for these kinds of projects, and we still don't think it's enough.
Thank you, Irina.
First of all, I would like to thank for this information that Russian speaking SLT, that parents have rights for support home language, but they really don't have this information. And question is why kindergartens and school can't provide them this information, why they should dig it. And another thing that probably they don't have, they don't dare to ask it. In terms of this political situation in our country that can feel reject, and they really don't have even this idea that something can be for them in this country. Do you understand what about I'm taking? Just a comment.
Yeah, I do. And actually, one more comment about. I mean, this makes the problem even greater in terms of awareness and information. I think, you know, schools and preschools don't necessarily always know on the level of the teachers, and you know, they can often resolve this by providing some sort of L1 language and culture instruction within classes of, for instance, Russian as a second language, which isn't the same thing, and it's complicated whether that actually addresses the need to develop the home language. So there are different ways in which schools and local governments resolve this or claim to have resolved this, which don't always address the actual need of the children and the parents. The larger questions about attitudes towards why should Russian be developed, or other languages too, but particularly Russian, that goes, I think, beyond what we're able to discuss today here. But I hear your concern.
Yeah, thank you.
Thank you very much for both presenters, for sharing experiences of a special education background with SLT, which is good, because SLT stemmed from psychology and special education needs. As being a linguistic background myself, I would like to thank your contribution in your presentation. Both of you have contributed a lot. But one question and one suggestion I have. One question is how difficult was it for you? Why were you interested in speech and language therapy as a linguist? That's one question, because I have been trying to persuade my linguist colleagues for many years without success to be interested in the linguistic aspects of the home languages, which is very important, because unless you have that kind of basic research, you cannot expand anything, including developing materials and so on and so forth. The same is with special education as well. So coming together, the collaboration of different disciplines, within speech and language therapy concept is very important. That brings me to an offer. As being a linguist, I am very keen on the meaning of the words and the terms. And I see that most of my colleagues, including the special ed and the linguists and the SLTs, all use typical development. But it is a statistical term. I mean, what do we mean by typical development? Because multilinguistic aspects does not refrain us from talking about typical development, because multilingual children have their own way of sort of, developing or acquiring the language. When it comes to special education, for example, autism spectrum disorder children or children with Down syndrome have their own parts. They have typical developmental issues as well. So I think we have to reconsider using the terms more carefully, so that it would make us focus on the main aspects of what we're dealing with. And that might be an opportunity to collaborate between different disciplines. Thank you for your presentations. Thank you. I learned a lot.
It's certainly true that in certain disorders we see even more rigidly typical pattern, in a different sense of typical. Do you have any good suggestions of what we could use instead? Because we've definitely seen worse terms in the history, like normal population and things like that. So it looks like the field has, but I like these questions as well. I love thinking about it. My students are often unhappy that I like to think about them too much. I'm happy to have a coffee and talk more about this if maybe we could come up with a better term, but that seems to be the one that the field has agreed to use for now.
Yeah, looking at the watch, you can have one last comment.
Thank you. For the first presenter, I have seen that it's on the project to create an assessment battery toolkit.
Mm-hmm.
Yes.
That's the dream.
Okay. We are at the moment on the standardization phase in the Greek population. We have created an assessment battery toolkit about speech sound disorders between children 4 to 7. Mm-hmm. And that's another story, because we have also orofacial to include, phonological assessment, etc. The difference on that is that we are relying to have the results, and the input and the results with LLMs, with machine learning, etc. So we are more than happy to share this and thinking about, because I know that you are technologically advanced here.
Yeah, we do pride ourselves in that, but absolutely, I think that is too often the case, that we are inventing a bicycle in different corners of the world again and again. Events like these are incredibly important for making sure that we don't do that and instead put our energy into developing something new. And we just talked about the exact same issue with a colleague from Croatia. I think we should have a colloquium and exchange what we have learned. Absolutely. Would love to do that.
Yeah, Maria, you want to say something?
Yes, if I may ask a question, because many of us in this room are clinicians and don't have the research background. Could you, what will be the 2-3 most important recommendations you will give to a speech pathologist working with a multilingual population?
I think the most important thing is to, first of all, to be aware that this child has a, something about the multilingual background or the language background of the child, and when possible, to try to get a sense of what proportion of their lives they spend in each language, so how much exposure they have to each language. Because without that information, it's really hard to assess the child based on the language of the school setting or the educational setting. That is, I think, sort of foundational, and often it's more complicated, and it can be overlooked. But I think the awareness that bilingual children learning a second language can make similar errors and can say things that seem like, that might look like the same sorts of productions that language impaired children make, but that doesn't necessarily mean that they should be assessed as impaired. So I'm just going to say that one thing as a really, really important piece of information before you can move on to anything else about working with bilingual or multilingual children.
And sometimes we are forced to, not forced, quote unquote, choose as bilingual speech pathologists, choose the language that you do target within speech therapy. So would you use the exposure that the child has in different languages to decide in what language you implement your speech therapy? So if a child gets more exposure on language one, would you recommend doing the speech therapy in that language?
I'm not sure I'm the best person to answer this. I think it's a complex question that both the child's needs and the child's experience and exposure should enter the equation. Yes, I'd be happy to talk about it more with you afterwards.
Okay, one last, that will be the last remark. Yeah, unfortunately, because our time is ticking.
I just want to thank you for both of you, in fact, and you revived my memories about the COST project by using your tools. I remember those days that I involved in those projects, the Litmus project. You have used the revision the tests and tools for repetitions and all the other tests, vocabulary tests, and these are especially designed for the multilingual society. And we were with Seyhun Topbaş and İlknur Mavişmi, both involved in this project for many, many years, and we have adopted as well those tools into Turkish, and we are using it. Although we are not a multilingual society, yes, we are, but in those...
Politically we are not, but we are.
Yes, I know. All the societies are more or less are bilingual, but not as much as your societies maybe. Russian and Estonian and the other languages are very primary in your languages. And in those days, we are not focusing on those bilingual or multilingual things. But we have adopted without funding, in Turkey, we don't use fundings very much, but we always adopt those tests and tools by PhD thesis and with our students or SLP's teams, it's not very difficult, and they are indeed very useful for the SLP students. Thank you very much for your both projects. Thanks.
I want to thank you for all this really interesting discussion. I believe truly that...
May I interrupt for a minute? I'm sorry. Could you please stay for a group photo before you leave? Request from the organization committee. Thank you.
But until then, I truly hope that you all will take something home from here. You got inspired, really, after this terrific seminar, and really, really inspiring speeches. Now I truly believe that Keiu and Sahra would love to say some words.
Is it on? Yeah, it's on now. Well, I just want to use the opportunity to thank once again all the participants. I really hope that it was an inspiring seminar for all of you, and especially a huge thanks to our presenters. So enjoy your weekend and have fun.